Erectile dysfunction is the inability to get or maintain an erection satisfactory for ejaculation. An erection occurs from the nerve bundle releasing nitric oxide over the cavernosal artery in the penis, causing engorgement of blood to flow in the erectile bodies that have these sinuses called lacunae that fill with blood, causing penis to engorge with blood, causing an erection. And that trigger can be stimulated by reflexogenic erections, something touching the penis, causing the spinal cord to reflex and turn the nitric oxide to be released by the nerve, or the brain to send a signal down to the spinal column to stimulate an erection. Erectile dysfunction is actually pretty common. So the Massachusetts Male Aging Study kind of elucidated that 25% of men will actually have some form of erectile dysfunction in their life. Erectile dysfunction has many causes, right? You got psychogenic, you have low testosterone, right? You've got hormonal imbalances, you've got medications that cause erectile dysfunction, smoking, you've got issues with surgical procedures, removing the prostate, you've got issues with patients having injuries and things like that. So there's a myriad of reasons for erectile dysfunction, and and other things. It can be high cholesterol, high blood pressure, and diabetes. And these incidences increase as you age. So as you age, you're more likely to have erectile dysfunction because you're more likely to have those medical issues. Erectile dysfunction, usually you diagnose it yourself. You look down at your penis and you're like, oh, it's not hard right now, I got a problem. But for most patients in the office, we diagnose by penile Doppler, where we inject either Bimix or Trimix into the erectile bodies and document blood flow. The other way is by checking hormones and seeing what's going on as far as, does the patient have low testosterone causing their erectile dysfunction, their undiagnosed alcoholism, tobacco use that's affecting their erectile function, cancers, or other issues that could be causing erectile dysfunction. It's commonly done in the office with physical exam and penile duplex. Yes, ED can be prevented, right? So a lot of people, and a lot of men in particular, can prevent their erectile dysfunction by watching what they eat, right? So estrogen rise from weight gain will cause testosterone to be ripped into estrogen from fat cells. That'll drop your testosterone down. When you have lower testosterone, that can cause erectile dysfunction, right? 1. 2, cardio, right? So you wanna make sure that your heart muscle is pumping blood to your penis. So you wanna make sure that you have good cardio so the blood will pump to the penis. So that's another way to prevent erectile dysfunction. The third way is use it or lose it, right? So like any muscle, the mind, any muscle, bicep, arm, if you don't use it, it'll eventually waste and you'll lose it. So patients that are sexually active as they age will stay sexually active as they continue to age. So those are important ways to prevent erectile dysfunction. What are the benefits of seeing a specialist? Is why not, right? So, I don't get sushi from a gas station, I get gas from a gas station. So if you want to know about your penis, you go to the specialist who knows the most about it. They can give you the answer you need. So what you don't know in the world of your penis will hurt you. So I'd go to somebody that knows the most about this. So I wouldn't get my erectile dysfunction advice from a GI surgeon or a cardiologist. I'd get it from the andrologist, urologist, right? So I stay in my lane and I make sure I hyper focus on sexual dysfunction, erectile dysfunction. So I can be the best at giving you the best advice and seeing the most patients with this hyper hones my skill set. So I'm probably the most authority person you could see on that. The psychological effects of ED erectile dysfunction are big. They're huge on men, right? Because your penis is where religion meets medicine, meets your mojo, meets science. So when you have erectile dysfunction, you kind of lose your man card in a way, right? So you've been having erections since you were inside your mom's body in utero, right? And when you lose your erections, then all of a sudden you've lost part of being a man. And so it can be so devastating that it even drove Ernest Hemingway to shoot himself in the head, from having erectile dysfunction. So it has a devastating effect. Now I did a surgery recently on a patient and he said, I'm turning back into a man, right? Because I'm getting my penile implant put in, so I'm turning back to become a man again.